are the lovely ladies, Divine Nine, my sorors, my sisters. And Monica had a very good question concerning the vaccine. And there was some skepticism of why it was kind of rushed and wasn't FDA approved. Or can you speak to that?
Well, absolutely. And I've been listening to your panel dialogue, and these have been great questions that everyone has been asking. So thanks for bringing everyone together and letting me be a part of it. Here's what I would say. Look, it's really important, first of all, when people have concerns about the vaccine, for us to start with listening to them. And it sounds like that's what all of you are doing with your friends. That's really important, because when we start judging people or make them feel like we think that they're somehow foolish for asking these questions, that's when people shut down, and they don't feel respected. So we start with listening. The second thing then is to figure out what their questions are, and then we can get to answering them. If people are worried about this vaccine being only emergency use authorized as opposed to approved, here's what I would tell them. Number one, the FDA, typically to approve a vaccine, it usually requires a lot more time, a lot more data. The emergency use authorization was pursued because we were losing lots of people in our country. People were dying. Millions of people were getting infected. And that doesn't mean the corners were cut. What it means is that the FDA took a close look at the data and they said, okay, this meets the full thresholds for emergency use authorization, which means, very importantly, that it tells us that the benefits here of this vaccine outweigh the risks. And that actually has been borne out now, not just by the trials, but by more than 130 million people in America who have gotten the vaccines, right? And that's a whole lot of people. And the CDC is keeping a really close eye out to see, are people having any serious side effects that we should be worried about. As Dr. Nunez-Smith said, they paused on the Johnson & Johnson vaccine really out of an abundance of caution, even though there were only 6 events out of 7 million plus they detected. But the key thing that I tell people all the time is, look, we've given these vaccines to well over 100 million people, and the safety profile remains really strong. Because keep in mind, Pfizer and Moderna, these are the 2 vaccines, not J&J, but Pfizer and Moderna, that are being given to the majority of people in the country. And second, just keep this in mind also, that Dr. Nunez-Smith and myself and doctors around the country, we prescribe and recommend vaccines all the time. But what we see also in how effective this vaccine is really quite strong. It's at the upper range in general of what you see with vaccines. So we're really blessed in a lot of ways to have a vaccine that has a strong safety profile. It's really effective. That's why more than 90% of doctors, when offered the vaccine, are taking it themselves.